Hello everyone, welcome to my channel The Social Science Academy. In this video, we are going to study chapter number 2 from NCERT book of Civics Class 7. The name of chapter is Role of the Government in Health. In the democracy, people expect the government to work for their welfare. Now, we know that India is a democratic country. So, in a democracy, people accept from the government that government has to work for their welfare. लोगों के अच्छे के लिए गवर्नमेंट को वर्क करना चाहिए, ये हम गवर्नमेंट से एक्सेप्ट करते हैं. Then, through which provisions government has to work for people of education, the provisions of education has to done by the government, health, employment, housing, or the developments of roads, electricity and etc. इन सारी चीज़ों की प्रोविजन गवर्नमेंट ने लोगों के लिए करनी चाहिए. वी एक्सेप्ट इट फ्रॉम द गवर्नमेंट. Now in this chapter what we are going to study? We are going to study the meaning of the health and the problems which are related to the health and the role of the government towards it. So first of all we will see what is health. What is mean by health? According to us, in general we can say the health means our ability to remain free of illness and injuries. Illness से injuries से free रहना मतलब health होता है. But if we want to free from illness and diseases, what we have to need? First thing, we need nutritious food. Nutritious food होना चाहिए. Then we need clean drinking water. Clean drinking water हमें मिलना चाहिए. Then where we live, that surrounding we have to keep clean, and as well as we have to keep ourselves also clean. Then we have to do exercise, we have to live in pollution free environment, and then only we will become healthy, and become healthy is very important thing in a life. With this all the things, the mental health, it is also very much important. If we will be free from any mental stress, then and then only these all the things provide us health. Then the condition of healthcare in India. What is the condition of healthcare in our country? Now here the two columns it has given. In that the comparison it has done, two types of conditions we can see which are totally opposite from each other. Now first, that is India has the largest number of medical colleges in the world and is among the largest producers of doctor. हमारा इंडिया largest number of medical colleges में है. हमारे इंडिया में largest number of medical colleges है and it produces largest number of doctors every year. हर साल हमारे यहाँ के डॉक्टर्स जो क्वालिफाई होते हैं वो बाकी देशों से ज़्यादा होते हैं. Then another side we can see the most of the doctors they settle in urban areas. After qualifying they become settled in urban areas, and due to this reason the people who live in the rural areas they have to travel a long distance to get a ट्रीटमेंट. जो विलेजेस में रहने वाले लोग हैं उनको बहुत सारा ट्रैवलिंग करके ट्रीटमेंट लेने के लिए इन लोगों तक आना पड़ता है. हेल्थ केयर फैसिलिटीज़ दीज आर ऑल्सो ग्रोइंग एवरी ईयर. हर साल हमेशा हमारे यहाँ पे हेल्थ फैसिलिटीज़, नंबर ऑफ हेल्थ फैसिलिटीज़ इंक्रीज हो रही है. नंबर ऑफ गवर्नमेंट हॉस्पिटल्स आर ऑल्सो इंक्रीजिंग. एंड इफ वी विल सी टू द अनदर साइड that lack of people every year they have to lose their life due to the different diseases. They are not getting a treatment properly on time. Then India gets a large number of medical tourists from many countries. They come for treatment in some of the hospitals in India that compare with the best in the world. Medical tourist भी यहाँ पे हमें दिखाई देते हैं to get the treatment. Now there are some of the hospitals which gives the best treatment in the world. And at another side, totally the contrast condition we can see here, we are unable to provide clean drinking water to all. हमारे सभी लोगों को हम क्लीन ड्रिंकिंग वाटर तक नहीं एबल प्रोवाइड नहीं कर सकते, जिसमें से 21% ऑफ द कम्युनिकल डिसीजेस जो वाटर बॉर्न है, फिर भी हम सबको क्लीन ड्रिंकिंग वाटर नहीं प्रोवाइड कर सकते. Then the next it comes that India is the third largest producer of medicines in the world and is also a large exporter of medicines. दवाई बनाने में थर्ड रैंक पे है हमारी कंट्री, मेडिसिन बनाने में, मेडिसिन प्रोडक्शन में थर्ड रैंक पे है और लार्ज एक्सपोर्टर भी है मेडिसिन का. एंड एट अनदर साइड वी कैन सी दैट half of all children in India do not get adequate food to eat and are undernourished. हमारे देश के आधे से ज़्यादा बच्चों को हम पेट भर के खाना भी नहीं दे सकते, वो अंडर नरिश्ड है. सी एट वन साइड वी आर इन द एडवांसमेंट इन द मेडिकल साइंस. ओके, मेडिकल साइंस में हमने बहुत डेवलपमेंट किया है, बट एट द सेकेंड साइड, in the second column, we come to know that we are unable to provide medical services to each and every person of our country. Okay, we are unable, government is unable to provide these healthcare services to each and every person who lives in the country. Now, which are the reasons behind that? Different reasons are there behind that we are going to see in this lesson. Now, the next we will see the healthcare facilities. Okay, we have divided, we have categorized these health facilities, healthcare services into private and the public. Okay, so first we will see public healthcare services. Now, what is mean by public healthcare services? The public health services which is provided, which is run by the government के द्वारा रन किए जाने वाले जो सर्विसेज है, these are the public healthcare services. Why these are called as a public healthcare services? Because first of all, these are run by the government, and through the taxes which was collected by the public, government has developed, established these services. So these are the public services, and its first duty, it's a primary duty of a government to provide best medical services or healthcare facilities to each and every person in the country. Now we can see here, healthcare centers are developed in a villages, in a rural areas, and we can see the big hospitals, large hospitals in a large cities. Okay, so they have a link between them. How they have a link between them? Why they have a link? To provide treatment from common illnesses to the special services. कॉमन इलनेस से लेके स्पेशल सर्विस प्रोवाइड करने तक लोगों को ट्रीटमेंट ये सभी डिसीजेस के लिए मिलनी चाहिए. इसकी वजह से दिस ऑल दिस सेंटर्स, हेल्थ केयर सेंटर्स and these hospitals, these are linked together, which are present in the rural areas and the urban areas. Now, as we know, these are developed by the taxes which is collected by the government. Now, another thing is important, that government's important function is that they have to provide the facilities which prevents from the spread of the diseases. जो diseases spread होते हैं उनको prevent करना, ये भी एक इनकी जिम्मेदारी है. जो हेल्थ सेंटर्स है उनकी ये भी एक जिम्मेदारी है. And it is not only possible only by the government, but our participation is also very much important. Okay, as it is a primary duty of the government to provide the best health facilities to each and everyone on time, it's our duty also, whatever the decisions it has taken by the government, we have to follow, and our participation is also very much important. Then the next category, it is that the private healthcare services. Now, as we have seen that when the doctor qualifies, what they do, they go and settle in the urban areas, and due to this, the wide range of private health facilities has exist in our country. Okay, large number of private services, private फैसिलिटीज़, दीज आर इस्टेब्लिश्ड इन आवर कंट्री. अभी हमारे कंट्री में बहुत सारे प्राइवेट हॉस्पिटल्स, क्लिनिक्स लोगों ने, डॉक्टरों ने बनाए हुए हैं. एज दे आर गेटिंग अ प्रॉफिट फ्रॉम दैट, for that purpose they have established, they have started their own clinics, their own hospitals. Then there is no control of government on this. So for that reason, what they can do, whatever the facilities they provide in their hospitals, in their clinics, they are taking a lots of money from the patient. If the patient, they are using the facilities from these centers, they have to pay, they have to spend a lot of money on the services or the facilities whatever they have used, and the medicine cost and everything, it is also very much expensive in the private healthcare facilities. Okay, so the cost of treatment is very much expensive in the private healthcare facilities, but then too the people they take the treatment in the private healthcare facilities. Now, healthcare and equality. Is there equality to get facilities, healthcare facilities to each and everyone? Now, that answer is no. Okay, each and every person they are not getting healthcare facilities, healthcare services equally. Why? See, there are economical status who people, the people who are poor, who cannot afford the cost of treatment, they are mostly neglecting to take a treatment. वो ज़्यादातर क्या करते हैं, ट्रीटमेंट लेना ही नहीं चाहते. Okay, if they want to take a treatment, for that purpose what they have to do, if anyone is ill in their family and it is necessary to take the treatment, at that time what they have to do, they have to borrow money or else they have to sell something from their belongings. उनको एक तो मनी, एक तो उनको पैसे कर्जा लेना पड़ता है, या फिर उनको क्या करना पड़ता है, कुछ तो घर में से बेच के उनको ट्रीटमेंट लेनी पड़ती है. ऑलरेडी द फैसिलिटीज दीज आर नॉट प्रॉपर in a rural areas, in the villages the facilities are also people they are not getting properly. In the tribal areas the facilities are very much poor, and whatever the facilities are there, these are not running properly. Then it is about the poor people who cannot afford the cost of the treatment. Then another thing is also there about the women. The health of women, it is not that much importance in the family. The importance of the health of women, it is not given in the family. However, the men they feel ill, if they are not feeling well, immediately they go and they take the treatment. But at some time if a woman she is not feeling well, at that time one part we can say she also neglects her health, and sometimes the importance it has not given to the health of a women. So these are some of the reason, poverty of a people. Okay, then the health concern of the women, due to this reason the treatments they are not getting to the people. Now what can we do for that, what can we do for that? That government has to provide facilities equally to each and every person. Okay, mostly they have to work for a poor people and the disadvantaged people. They have to provide facilities to such people who are not getting such facilities on time. It's government primary duty to provide healthcare services to each and every person in a country, and at time that services has to be given. Then to overcome such problems we are going to see two examples how the ways it has found by these governments. First example we are going to see, which is from Kerala, one of the state of our country. The Kerala experience, what Kerala government has done in 1996. The Kerala government they have made some changes in the decision. What they had done, 40% of the entire state budget it was given to the पंचायत. उनके एंटायर जो स्टेट बजट था उसमें से 40% उन्होंने क्या कर दिया, पंचायत को दे दिया. फॉर विच पर्पस, ड्यू टू दिस दे कुड प्लान एंड प्रोवाइड फॉर देयर रिक्वायरमेंट्स. जो लोगों के रिक्वायरमेंट्स है वो क्या कर सके, उनको प्रोवाइड कर सके. फॉर दैट पर्पस 40% ऑफ द एंटायर बजट दे हैव गिवन टू द पंचायत. Now this made it possible for a village to make sure that proper planning was done for water, food, women's development and education. They have solved और दे कैन वर्क ऑन दिस प्रॉब्लम्स. कौन कौन से प्रॉब्लम्स पे वो क्या कर सकते हैं, वर्किंग कर सकते हैं और या फिर प्लानिंग कर सकते हैं. water supply, then the food to provide adequate food, women's development and the education. Okay, so what they had done, whatever the problems the people they were facing, they have provided the facilities related to education, then the adequate food, then the clean drinking water. They have checked that all the facilities, and they have improved themselves, and they have taken up their villages up. Then to some problems they are facing, and they are solving, they are trying to solve this problem. So it is one example we have seen, which is from our country. Now one more example we are going to see about the Costa Rica. Okay, what the government of Costa Rica they have done. So the Costa Rica is considered to be one of the healthiest countries in Central America. सेंट्रल अमेरिका की एक हेल्थीएस्ट कंट्री कोस्टा को माना जाता है. Why is it so? Because several years ago, Costa Rica took a very important decision and decided not to have an army. Which decision? Several years ago, which decision it has taken by the Costa Rican government, that they decided not to have an army. उन्होंने क्या किया, उनके देश की आर्मी ही कैंसिल कर दी. And this helped the Costa Rican government to spend the money that the army would have used. Now whatever the money it needs to maintain the army, that all the money they have used to the people. Okay, to give to they have used that money on health, education and other basic needs of the people. Whatever money it was spent on the army, that all the money they have used on the health, education and to provide the basic needs to the people. Now, the Costa Rican government believes that a country has to be healthy for its development and pays a lot of attention to the health of its people. Now, it is very true that if the people they are unhealthy, the people who lives in a country, if they are unhealthy, it is not possible to develop a country. Unhealthy people they can't work properly. If they will not work, then how the country will develop? अगर people ही unhealthy है तो वो काम कैसे ठीक से करेंगे? अगर काम अच्छे से नहीं हुआ तो हमारी कंट्री भी डेवलप नहीं हो सकती. सो इट इज़ वेरी ट्रू that unhealthy people they can't develop the country. If the people who live in a country they are healthy, then and then only the country will develop. And due to this reason, the Costa Rican government they have taken such step. Now, the Costa Rican government provides basic services and amenities to all Costa Ricans. जो basic services थे वो सब उन्होंने क्या किया, सब लोगों को provide कर दिया. For example, it provides safe drinking water, sanitation, nutrition and housing. These all facilities it has provided by the government to the all Costa Ricans. Another thing it was considered very important by them, that is the health education. They believe that the knowledge of health it is very much important and it is very much essential part. It is the essential part of the education. It should be the essential part of the education to give a knowledge of health, how to maintain health, how to become healthy. The knowledge it should be given to everyone. So on that also they have worked. So it was the two examples that we have seen who have worked to overcome the problems related to health. So these are some of the steps it has taken. It is possible to everyone that they can also work on the health of people who live in their country, because if the people are unhealthy of a country, then the development also will not occur of the country. If you want to develop the country, people should be healthy who live in the country. I hope you have liked this video. Like it, share it and subscribe the channel and press the bell icon. It means you will get the notification whenever I will upload the new video. Thank you.